Welcome back. We're continuing our conversation with Dr. Carrie Hale about knee replacements. So thanks for sticking around with us, Dr. Hale. So just to continue that conversation, like we said, are knee surgeries, regardless of whether it's the full replacement or a partial replacement, are they always 100% successful with patients?
They are not always 100% successful. Knee replacement surgery is a very successful surgery, and somewhere 90 to 95% of patients are really happy that they had it done, but there's always complications that could go along with a big surgery like that.
Okay, are there things that patients can do to ensure that success rate?
I think the best thing to do, again, is to try to be as fit and healthy as you can be going into it. And then certainly physical therapy and doing the exercises that we need you to do after surgery plays a really big role in getting the knee range of motion back and the strengthening of the leg back after surgery.
Okay. And then how long does that new knee usually last for a person?
So we don't entirely know the answer to that. There's really good 15-year data out of the Mayo Clinic showing that at 15 years, 98% of all knee replacements are still functioning well. And the interesting part of that data is that it's data from implants that were 15, 20, 25 years ago. So hopefully the implants that we are using now, the surgery that we're doing now, will be even better, last longer.
Okay. Has there been times then where that 15 years has come up and somebody has been a good candidate for a second knee replacement, or does that not really happen?
That definitely does happen for a number of different reasons. And that's called a revision knee surgery, and those are successful as well, although the success rate goes down a little bit and the complication rate does rise a little bit with a second, third, fourth surgery.
Okay. And we were chatting during the break and you mentioned that knee replacement surgeries are actually on the rise. Can you talk about that a little bit?
Yeah, they've definitely skyrocketed in the US and worldwide. The number of people that are living longer and are more active as they're getting older has risen dramatically, and so therefore the need for knee replacements has as well.
Okay. And does health insurance usually pay for a knee replacement surgery?
Yes, they do. Sometimes there's different conservative treatments, medications, physical therapy, that kind of thing that needs to be done first before the insurance approves a replacement surgery.
But yes. If you go through that, then okay, great. All right, so let's switch gears, or joints, as the case may be, and talk about hip replacements now. What are some of the reasons why somebody might need a hip replacement surgery?
Very similar to the knee replacement. The most common cause is that osteoarthritis, wear and tear arthritis of the hip. Sometimes injuries can play a role when we're younger. There's an entity called avascular necrosis or osteonecrosis of the hip that can occur, which is the same outcome, needing to have a hip replacement, just a bit of a different mechanism of an injury to the hip.
So again, as we asked about knee replacement, are there other alternatives or options for folks other than surgery? That I know the hip obviously is a little bit different than the knee, but can you do physical therapy and things like that for that instead?
You can, physical therapy, anti-inflammatories. I typically don't recommend much in the way of injections for the hip. They don't seem to work nearly as well as they do in the knee.
Okay, and then are there partial hip replacements? Is that similar too, or are there different kinds of hip replacement surgeries?
There's what we call a total hip arthroplasty, which is what the vast majority of surgeons in the US are doing. There's something called a hip resurfacing surgery, which has, for the most part, fallen out of favor because of the bearing surfaces that are used in that surgery. It's called a metal-on-metal hip, and most of us are not doing metal-on-metal hips at this point because of some issues that have arisen with them.
Okay, so what is used if it's not metal anymore then?
Yeah, so in a hip replacement surgery, the femoral head, or the ball of the hip, we take that out, and a stem, typically a titanium alloy stem, is used to, it gets inserted in the upper portion of the femur, and the bone grows onto the stem. And then either a metal or ceramic head fits onto that stem. And then there's again a titanium cup, which gets inserted into the pelvis, into the cup of the hip, and again bone grows onto the back of that. And then usually there's a plastic liner that snaps into the cup, and so the head articulates with the plastic liner.
Okay, wow.
Yeah.
So metal still is at play, it's just avoiding that metal on metal part.
That is correct.
Okay,
yeah.
Gotcha. Okay, and so again, at what point would you recommend hip replacement surgery for somebody who's experiencing pain or different hip conditions?
Yeah, so once again, it's when that pain and dysfunction is bothering people enough in their daily life. Hip replacements may last longer, and there's actually a little bit of a better patient satisfaction rate overall with hip replacements versus knee replacements. Patients that are a little bit younger at times with hip arthritis are offered hip replacement surgery, maybe versus a knee replacement surgery.
Okay, all right, great information. We do need to pause for yet another break, but there's still more to learn about hip replacement surgery. We'll continue our discussion with Dr. Hale right after these messages. Stay with us, we'll be right back.